Hi again on one of my short little quickie sort of live ones, and I expect you'll be joining me in a minute, some of you. But the theme I'm going to talk about today is really, you remember last night Jane and I do our Saturday night live, and we had to do it here from my office because we had a bit of a problem. Actually, we didn't tell you about it at the time, and that problem was that we had to take my daughter to the accident and emergency services because she had a problem that the doctor said you get to the hospital now and get it checked, right? So we did that, we got it checked, but what happened is kind of the theme of what I want to talk about now, because accident and emergency and the health system here in the UK, I just want to air a few thoughts about this. So it's not really psychic as such, but it's kind of some of my views, and I think some of you kind of quite like some of those ideas. And where is free health and free healthcare going to go in the future, not just here in the UK, but also in America with Obamacare, for example, and around the world in the other democracies of the world, in India and places like that. What's going to happen to it all? But one of my thoughts. So this is what happened. Okay, we took my daughter to accident and emergency last night, and there was two issues there that worried me deeply. Obviously, the health system at the moment is under severe duress because we're just coming out of COVID. There's still the problems with that. They've done miraculously well, really, and also there's a huge backlog. But there's a couple of things that worried me. The first one was there was a young girl there who was suffering from what to me was clearly schizophrenia, and she went to the place looking for help, looking for guidance. She was hearing strange animals and she was hearing voices. Only a young girl, but she was obviously in a lot of distress and didn't know what to do and was feeling very suicidal, so she reached out for help. She didn't know where to go, what to do, so she went to accident and emergency, and there was absolutely zero facilities for someone in that condition. Really, they seem to just patch people up nowadays. There, patch them up and send them home. So that's something, no visible harm, off you go. And the problem is a lot of people are heading for accident emergency because they can't get appointments with their doctors. We have to have it all done now virtually by Zoom and by Skype and that type of thing. And they don't know. She didn't know where to go. And basically, she was sort of told to go home, and they arranged for a psychiatrist to contact her on Monday. But the poor girl was suicidal. She was in absolute terrible distress. And that's one of the things that worries me. There's nothing out there for people who have there's all lots of different psychic terms for it nowadays, personality disorder and things like that. But I always understood it as being like schizophrenia with auditory hallucinations and sometimes visual hallucinations. You imagine if that happened to you and you didn't know what it was and you're a young person, terrifying. And it can be fixed, of course, if it's caught quick. If it's caught quick and the right medications are given, a lot of those conditions can be caught early, like most things. Early diagnosis, early treatment makes a lot of difference. So there's one thing, and I don't know how you guys think, because take some of your ideas in a minute. There's one thing that worries me, that sometimes in the accident and emergency, we're not getting people treated the right treatment. They're under duress, they're under terrible stress, so it's completely understood. But really, we need to start looking at some sort of emergency treatment for people in that condition. And the other thing, now, Bevan arranged that the National Health Service is kind of free for everybody. There's no difference between rich and poor. We can all get, in England and the UK and Scotland and Ireland and all the rest of it, we can get healthcare, and we know we're going to get treated, and we don't have to pay for it. And most things, dentistry, we pay for, yes, up to a point, and some other services. But the whole concept of it is it's free. But then that girl was sent home, and in that same department were a number of really badly disruptive drunks. And this on a Saturday night is one of the major problems that the health and accident and emergency have to deal with. Drunk people. I mean, my daughter saw it last night. I've seen it every time we've been on there late night and we've had to go in for something or other. There's always drunks. Now, should those people have any access to the health service when we're sending home a very vulnerable young girl who's just worried about suicide, and the staff, instead of chucking them out and sending the police in, they're trying to appease these guys, they should be dealing with drunks in an accident and emergency. I would say that if a person turns up in an accident and emergency, they're drunk, they will have to pay, right? And not only should they pay, they should be fined and have to pay as well, because that has taken all the resources that could have helped that young vulnerable person I've talked about. Has taken all those resources and they've had to focus on not only one drunk, but a number of them who are loud, disruptive, aggressive. I think, are we too soft? And another thing about the NHS, I'm ranting again, but I do feel these quite strongly. Our NHS system is working on the idea that we always kind of have to pull doctors and nurses from overseas. And they say we have to do that because, we haven't got enough trained nurses ourselves and so forth. Instead, we farm out all the cleaning services. But the nurses in the past, when Jane was a nurse, they would be spick and span. That's why our house is spotless all the time, because it's part of the mentality of being a nurse that you clean, you care, you clean, you care. You're really looking after and nurturing the whole environment around you. That's all kind of been thrown out the window now. But going back to the idea, we pull in nurses and doctors from overseas. And I think, is that really fair that we pull a doctor from Nigeria, or we pull a doctor from Indonesia or the Philippines and so forth, or South Africa, and bring them here to the UK, pay them higher wages they can possibly get at home so they never go back home again, but we desert and undermine all the health services of other services around the world? I mean, that's not fair. So I think that's another thing that's got to be looked at, and no wonder the Americans have been so resistant against the idea of what was called Obamacare, which I think is a very bad name for a free health service, because you've put somebody's name on it. We don't call the NHS Bevan Care here. We forget about Bevan, who set it up. I can't even remember what his first name was, but Bevan was the politician that got it started, as it were. But I can understand why a democracy like America can say, well, we can't have this because it's just so expensive. This is turning our country into a socialist country. They're wrong, in my opinion, totally wrong. But, the costs of it become extraordinary. And I think if we're going to keep it, we've got to find some middle way between it somehow. We've got to somehow say, is everybody, should everybody have an instant right to healthcare? Should a drunk person or a disruptive person have a right to healthcare? Should somebody who's come to this country and never paid any national insurance contributions have complete and total rights to healthcare, even though they've never given a penny in their life towards the cost of their care, be able to come here and have all their teeth done, any cancers sorted, all their problems sorted out, millions and millions of pounds worth overall, but often tens of thousands of pounds worth per individual? Should that be allowed? Shouldn't people coming into this country also have to carry health insurance, just like when we go abroad? If I go to France or anywhere, I have to have health insurance. So we're too soft, in my opinion. And I think the danger with it is that we're in a chance, we're putting ourselves in a position where we could completely destroy our health system because we just simply will not be able to afford it. And really, the British health system, I think, is one of the best in the world and could be a model for the world, really. Could we not have? And I think one day this is something I think will happen in the future, because as I said, I see an era ahead, long term ahead, of a world where we will have a better world. When I was talking about politics of the future, and I think we will one day have a world health service which is free for everybody. It's an impossibility at the moment as we see things and the way the world functions. People say, oh, you're a dreamer, Craig. But I was really impressed by how Sathya Sai Baba in India set up free hospitals in India for heart surgery and things like that. You know, there are models that can work. And it requires us taking a new attitude of seeing almost health and healthcare not as a profession, but almost like a calling, in the same way someone might be called to a religious calling. You know, you don't go into it because you're going to be paid a fortune as a surgeon. You go into it because you perhaps are paid nothing as a surgeon, and you do it entirely as a matter of service. And I think this idea for the future, this welding together of healthcare and religious, spiritual, not religious, spiritual calling, may almost become part of a new religion in the future. And that sounds an odd idea, but I feel that something's going to happen in the far future where there's going to be a new awakening I've talked about. And I think part of that awakening might actually include the idea that healing and even medicine are all part of the new religion, the new spirituality of the future. So there's some thoughts for you. Okay. I expect some of you think I'm a bit bonkers with what I say with some of these things, but you know, what do you think? I'd like to see your opinions. I'm going to have a look at, put up some of your ideas now, but if you just joined me, you know, after I've gone live, put your thoughts, put your opinions. What about the American system? Should the Americans not have some form of free healthcare? You know, why my grandson is diabetic, you know, he has to have insulin jabs over every time before he eats anything. Even he has an ice cream, he has to have a jab, you know. Why should people in America not be able to have insulin? What would it be like not to be able to afford your insulin, you know? So is that a barbaric thing? Is that something that's really wrong with American society, for example? And same in Australia, you have a healthcare system, but it's very much on a private sort of system being put forward there, I believe. You know, how can we do it? Is there a way? Is there a way perhaps that we can have a international world healthcare system? Or is there a way perhaps that we could maybe do you think I'm right in saying that maybe spirituality and medicine can one day become one and the same thing? Anyway, let's have a look what you've been saying. There might be all sorts of awful comments here. I've put a few hellos up as I'm having a look through, actually. Yes, nothing is free. That's true enough, actually. I'm just saying, putting your hellos up as I have a look through. I won't respond to you all, guys, because I'm, you know, I'm just looking through and see what your comments are. And don't forget, you can put a. See, now there's one, isn't it? We don't need big farm. You know, big farm. The whole thing that's happened with this COVID and thing like that is showing us how dependent we are, again, on international world organizations, world companies, international blue chip world companies, to provide us with something that could save humanity or not. You know, I know whatever you think about these things with vaccines and things like that, if you put all that type of stuff aside, you know, we are dependent on a few capitalist organizations. We don't have, each country doesn't have its own way of producing all its medicines it needs. We depend, Britain got all theirs from India, for example. And going back to the insulin thing, most of the insulin is made in Denmark. So if the borders came down between Britain and Europe, where do we get our insulin from? We don't make it ourselves. It's all made, you know, in Denmark, where they have lots of pigs and things, which I think are used as part of the production of this. So, you know, it's some big questions, I think. You see, you all think the same. You know, do you think the same with big farms? You know, there's so much. What goes on in the background with some of this? You know, I've talked about how we get gagged, but do we really get to know what's really there? I mean, going in, have they perhaps already got cures for illnesses that they're holding back? You know, like it would be kind of pretty bad news if we could cure a cancer tomorrow with a simple drug, because there's so much money made in the other drugs that support it. It makes you wonder, doesn't it? You know, it makes you wonder, is there something there in the background that's you know, that's the stuff that they hold back and don't give us? Yeah, she was fine, thanks. She's fine. She's okay. There's nothing to worry about. So you're asking me about other questions here, but the NHS is finished. Too much waste in all the departments, overpaid management. Isn't that the same? And isn't that the same in charities too? I mean, you hear of the wages that people get in charities, £100,000 wages for a manager and more in charities. I mean, shouldn't we be doing this sort of work almost for free? These things are life-saving things, aren't they? It's like when too much money's put in something, it becomes almost bad taste to it, doesn't it? And people go around with clipboards looking important. There's massive wastage. So how can we ever become a model for the world when there's that sort of being wasted? And hi, Nick, again. It's nice to see you again online. The US is divided on this issue, right? Has been divided on this issue my whole life, right? One side says it's a basic human right to have universal care. True. The other side says a national system will be mismanaged and corrupted with stolen money. And that's a really good summary there, actually, of the issue that we're faced with. And I think, actually, the side ultimately that will win out on this is that it is a basic human right. I think that has to, sorry to use this word, it has to trump it in many ways, because surely life comes first, and although I could completely understand why so many Americans find the whole idea that was put forward with Obamacare as a very dangerous system, because the money goes in and where does it go, and the way big pharma in America has gone so far, it could just go all into the wrong pockets, and it could just actually even collapse the whole system because it is so massively expensive. I'm going to talk another time about the welfare system here in the UK, but surely this is you've summed it up, I think, there perfectly. What side do you guys fall on with that? Should we not always put human life first at any cost, or like that drunk that's taken away the resources and make it impossible for the system to work, should some people be sort of sidelined and say, well, why should everybody get it? Or should there be a system where you could perhaps go in and say, if you're desperate for it, you get it. It kind of works in the American system like that. They've got the welfare system, they call it there. I think they're welfare hospitals, is it? I think charity wards, that's it. But, okay, if you're desperate, you'll get it. If you don't quite need it and you can wait, well, maybe you should pay for that or get a tick into the system of some sort. And if you really don't need it at all, such as cosmetic surgery, or possibly you could even put fertility into that. That's a bit dodgy, but, possibly those things perhaps you pay for. And perhaps we should substitute the hospitals by allowing things like surgery and, reconstruction surgery for cosmetic purposes and good looks, like people want to look like me, for example. So, maybe there's an argument for that, and it's true. Do you seem to agree with me there that sometimes people can just come to the country here in the UK and just get all the treatment they need? And again, the same thing happens obviously there in America, because you're in the USA. How can we sort that out? I mean, obviously we don't want anybody in the world to suffer, do we? But at the same time, the practicalities of it are that, like, the system can get overwhelmed. Our welfare system here in the UK, I think, kind of gets overwhelmed by people that are coming in that haven't put anything into it in the first place. Perhaps we should have 2 tiers of citizenship. That's quite a controversial one, but perhaps there should be 2 tiers of citizenship. Citizens who are from Britain, been born in Britain, their grandfather's been born in Britain, perhaps, and stage 2 citizenships are on the process to becoming full citizens. Very dodgy, what I suggest there. But I'm just putting some ideas out there. What do you think? Yeah, 1948. That's it. I couldn't remember his first name. I can't even pronounce it, actually. But it was all put forward with some tremendous altruistic big ideas, really, wasn't it? And do we not have some big ideas left for this era. You know, where's the big ideas at the moment? Where's the big ideas on homelessness, for example? You've got a massive problem there in California. I know something I predicted, you remember, a few years back, there would be a huge homeless problem. And I can only see that getting worse, not just in America, but everywhere. Surely, you know, how are we going to sort that out? You know, another basic human right, the right to have a roof over your head, to have running water, to have a lavatory. You know, I mean, you can't, people in an advanced society like America, I know some of you will say it's not, but it is. It's an advanced society. It was supposedly democratic. Has got homeless people camping out on all down the beaches and all down this alley and the skid alley type places that are beginning to reform there. You know, we got to start thinking differently about this, and we got to start sharing as well, haven't we? You know, and at the same time, we've got to be practical. It's ever such a difficult one. You know, I don't have the answers, but I mean, I'm just putting it out there. Maybe you got some comments, add some comments below. And see, some of you think America and in Britain, I do not feel the national health care is the way to go. So if we have it completely paid for, then people like my grandson would not be able to have his insulin, you know, and that as I take is the touchstone to it. That's the one that's brought it home to me because it's so close to home. How can you possibly deny healthcare to anybody? But maybe there's a way that some people should be charged, particularly if they're disruptive to the system, or perhaps we should have some form of insurance that runs alongside the free, depending on how long you've lived in a country, for example. So the NHS isn't free. No, it's not. It's paid for out of our taxes. And also a large part of the NHS isn't free. Dentistry, for example, you can't get a free dentist now, not for love nor money. And there's also different layers and levels of care. If you go private, you get much quicker results. But here, if you're on the free stuff, you wait for a long time. Is that right? That's like grammar schools and comprehensive schools. You know, should there be two systems running side by side? Shouldn't it be the same for everybody in a free society? So this is what you call socialism. You know, this is what you call, you know, everybody, the state intervenes and makes sure everybody's looked after. Or should the state keep their hands out of things completely and just leave it to free enterprise? Why do kids get diabetes? Some are born with diabetes. There's two types of diabetes. There's diabetes type 1, which you're born with. There's nothing you can do about it. It's like you've got no pancreas. And type 2 diabetes is often caused by can be caused by things like bad diet and obesity and things like that. But there can be other underlying causes too that can cause it as well as being prone to it through your genetics. Okay, there's a free healthcare already for poor Medicare, but illegals are getting much better care, first class over poor American citizens. You see, this is when the system becomes difficult again. Very difficult moral problems here, aren't there? You know, do we bring people here? So you see, the Dalai Lama, I think, said what we should do with the illegals and so forth is bring them in, give them all the healthcare, look after them, patch them up, get them fit again, and then take them back to where they came from so that they can go back and build their societies. You know, would that not be a fairer way of doing things? You know, we can't reject people and you know, because in America, like, you know, I mean, you brought up the issue there of the illegal immigrants coming in. You've got a massive problem again. You know, Biden said, we're going to sort all this out. We can't have all these people put in cages. So instead of putting them in cages and things that they did before under the Trump administration, now we go out with horses and horsewhip them. So it's almost like a comic farce, isn't it? You can't. We got to have big solutions to some of these issues, and many things are getting swept under the table, and I think the NHS is one of them here in the UK, and free healthcare in America is another one that really needs addressing. If you have to pay on NHS levy, if you came to the UK, it was $400 per year for your visa, but I think it has increased. Yeah, there are some things in place like that. That is true. Um, you're not bonkers, Craig. You're thought-provoking. Yeah, maybe. I don't know. I might not agree with you on that. My psychiatrist might disagree. So another. I always like your comments, Nick. While a universal healthcare system in US could be mismanaged or corrupted, but could the same be said about the existing private companies? Surely their prices are inflated for profit too. And we get exactly the same thing here in the UK. Those big farms will come over and have some fantastic cure that can really, solve a problem on some obscure illness, and then you start hearing things like it's £10,000 a shot and you've got to have this every day of your life or something. The prices are they've got to make a profit. That's fair, because the way that system works is they got to make a profit. But look at the buildings they're in. It's a bit like, looking at Vegas to see the profits they make out of the losses of gamblers. They seem to, and look at the wages they pay themselves, and look at the share prices. There's too much money being put in to the pockets of those that are running it all, aren't they? I mean, this is when capitalism, as it were, which is a system we have that seems to work, because I wouldn't want communism in this country, because that don't work either. But we've got to rethink the way we do things. We've got to start bringing the corrupt people to book a bit more, haven't we? Just like I was talking about with our politics, the way we're gagged and things like that. We're not able to give free speech. How can they get away with this? How can it go on? How if we're all enfeebled people, our vote seems to count for nothing in all the countries of the world. Australians are thinking the same at the moment. Americans are thinking the same. Britons are thinking. The people in the EU are beginning to think the same too. We think we vote for all these things, and we think we vote for all these things that we all care about. And when it's election time, NHS is top of the agenda. When it's election time, immigration is top of the agenda. And when it comes to actually sorting it out, they're all as bad as each other. They're just as corrupt as these people in big business. They hide and they don't give us. We don't know the truth. We don't know who to trust. Again, I'm going to do another talk later on, I think, about the way I don't think money and politics should be allowed to be mixed. People in industry should not be in politics. From India, yes, I mentioned about the Indian system as a very interesting one, of how that actually does try to help a huge population of people with many, many illnesses. But they may come up, perhaps, I think, with a system that might be a model that many more countries could follow, because I get a feeling that something good's going to come out of India. And this is where I say about the idea of mixing the idea of spirituality with medicine, as if, those people that we treat, doctors and surgeons and things, a bit like gods already, don't we, when we speak to them? And could it not be that they could almost genuinely become spiritual people, that you have enlightened surgeons? Maybe this is something, I sound bonkers, I know, with these things, but I think we're going to enter, when we talk about will we ever enter the new age, will we ever enter the golden age of the Greeks or the Satya Yuga of the Hindus, when we enter all those things that have been predictors of the great new age, one of the things that would have to change is our attitude to healing, which I include all of the medical fields. Surely this has to come from God in ourselves, surely. And I think people who have been born into this life as doctors and nurses and surgeons and anesthetists and all the rest of it are people who in previous lives must have suffered a lot themselves. They must have been called into wanting to take away the pain in others, because out of the compassion from having suffered themselves in previous lives. I think in many ways it is already a spiritual calling, but maybe in a more spiritual age, we will see that as more spiritual than practical. That the doctors may use science, which is our technique, but use spirituality as the driving force for their care and compassion that drives the people who do this wonderful work. So I think I'm going to leave it there now, guys, actually, because there's lots and lots of comments there, and I think I'll leave it at that point. Actually, could we not spiritualize medicine? We do spiritual healing. That's very much linked up with the idea of these sort of spiritual things that you guys who follow me and Jane here are interested in. That hand in hand with mediumship goes healing. They're both part of. We are, I suppose, Jane and myself, I like to think of ourselves perhaps as doctors of the soul. We help people on a soul level. So it's spiritually infused, but surely too doctors of the heart, which I suppose you could call the psychiatrists, and doctors of the body, which we have our actual doctors. They're all coming from the same spiritual drive. Surely anybody that wants to do that thing really must be driven not by money, or because my father was a doctor or a surgeon, or because I think I can make plenty of cash out of this. There must be behind so many of those great people a genuine compassion to want to help. Compassion. We got to put compassion back into our health services. Compassion should be the driving force. And then when I said, like at the start, about that poor girl that's turned away, who had the psychiatric problems, surely with compassion, we can never allow things like that ever to happen, ever. Okay, I'm through. Thanks for joining me. See you again soon. It was just a random one today. Thanks. And if you're here for the first time, please do subscribe. And actually, sell you something. I got some new Boo shirts and Boo bits and pieces and paraphernalia in the merchandise that Google allow us to do after we get a certain number of subscribers. So you can go and buy a Psychic Cat t-shirt if you like down below. Anyway, see you soon, guys. Thanks for joining me. Bye for now.